Now, on Family Focus tonight, the story of a woman who's managed to conquer her fear of going to the dentist. She was so scared that she put off going for over 20 years, not even taking her children there either. But finally, she sought help for her dental phobia, a phobia that apparently is incredibly common. Lisa Rogers is smiling now, but as a child, heading to a dental appointment was a huge ordeal.
My memories of the dentist would always be the dread of going to the dentist, you know, that feeling that you have in your stomach when you have to do something you really don't want to do. And the noise and the smell when you walk into the dentist. I hated the sound of the drill and I hated the smell of it. And then I hated the pain when I got in the chair because it was always sore. You know, the injection was sore, the treatment was sore, and so I just learned to dread it. And so therefore, as soon as I was 16 and Mummy wasn't taking me anymore, I just stopped going. Yeah.
And how bad would you say your fear was? Was it just a nervousness, or would you say it was a phobia?
Somewhere between the two, probably. I was very nervous about it, very fearful of going, and when I did have to go to the dentist, if I did have a toothache and I went to a dentist, I would have been practically rigid, lying on the dentist chair and wringing my hands and pointing my toes and absolutely dreading what they were going to do. And so, yeah, somewhere between fear, nervousness, phobia, all of the above.
And then you became a mum.
Yeah. And
you had to look after, I suppose, your daughter's teeth. But
yeah.
How would you say your fear passed on to the children?
By me not bringing them to the dentist at all. It was not very good. Holly, who is 8 now, went in nursery school once when I had decided I was going to get past my fear and I was going to take her to the dentist because I had to be responsible now. So I took Holly, Katie was only about 2 then, so she was a bit too small to go. So I took Holly just the once, registered at the dentist, and then never went back again. So
what were you scared of?
Well, I suppose when she was registered to go to the dentist, I had to go as well. So then the fact that I had to go back to the dentist put me off, and this is now 5 years later, and I found a different dentist, and I have now taken Katie for the first time when she was 6, and taken Holly back again now that she's 8. And really one of the reasons I was doing it was because they were hassling me to bring them to the dentist. They had no fear at all. I did always tell them the dentist was a great place, and the dentist helped you have a lovely smile, you know, the dentist would just look after your teeth and it would be great, and they were looking forward to going, and they were seeing lots of the other pupils in their class coming and going to the dentist every day, and they were asking, Mummy, why are we not going to the dentist? And so
were you feeling bad?
I was really. I was feeling so bad about Holly and Katie not going, and it was time that I should have went myself again, that I decided this time, instead of just driving past a dentist and seeing a sign and going in, I decided to actually take the time and look online and get recommendations and look up people, one that was especially for people who were afraid of the dentist, and that's where Gentle Dental by name. I just thought this is going to be a very gentle dentist, and it is, and so I have no fear about coming here at all.
Whenever you brought the girls here for the first time, did they have to get a lot of work done?
No work at all, no, because of my fear of the dentist, I did always ensure that they brushed their teeth meticulously after eating sweets in the morning and night time, and tried to keep their teeth as good as they possibly could be, so that when they did come to the dentist, they actually didn't need anything done. So next checkup in August.
And how would you say your fear of the dentist is now?
Now, I'm unbelievably doing things that aren't necessary. I'm coming to the dentist to get, you know, old fillings replaced to white ones, and a brace, and all sorts of things that really aren't necessary dental treatment. And I think it's because it was all eased in so gradually. The first time I came here, it was really just for a chat, and I didn't even have to go into the room that the dentist chair was in. And then the next time I sat in the dentist chair and let them look in my mouth, but no touching. And then the next time I went to see the hygienist, and then the 4th time was when I actually got a fill-in and did any treatment. And everything was done so gradually, and everybody was so friendly. The treatments have come on so far. that really, honestly, with numbing gel and then the injection and then the treatment, you really don't feel anything. It's a far cry from it was when I was wee. And so now, no fear. Yeah.
And what would you say to anybody out there who has a similar phobia?
Oh, really, you have to come back to the dentist now and give it a chance, because treatments have come on, the dentists have come on. I was afraid that they would be annoyed with me, you know, that they would judge me for not having come for so long, and that's something that put me off as well. But not at all, not at all. The dentists are so nice, the treatment's so nice, the place is so nice. Everything has changed from when I was wee.
And did you have, went back to when you were small, did you have any one specific incident that left you traumatised?
Not really, you know, I wouldn't say there was any one particular time, just the not having any numbing gel and having the needle, you know, if you're getting an injection coming straight for you, and it was a big needle and it was sore, and on some occasions you didn't get an injection at all. If it was just a small filling, you didn't even get that. So just to me it was all sore. I didn't like the noise, I didn't like the smell, I didn't like anything about the dentist, and I thought they judged you then and they thought they were cross.
And when you came here and you realised there was help and support available, was it reassuring to hear that there were quite a lot of people like you out there?
Yes, I mean, and the first time I was here, when I had the long chat with Adam, he reassured me and showed me evidence of the people who had been here, who the different, and showed me their smile before and their smile now after all the treatment and work they had done, and they were all like me. They were all afraid of the dentist at the beginning, but they all persevered and got, I won't say love the dentist, but got to quite like coming to the dentist, and and really seeing other people's achievements helped me to go. So
do you think you're addicted to going to the dentist?
No, I've been so many times this year. I'd say more times this year than in the last 20 years. So yes,
find a good one. Have no fear.
The girls love coming here. The girls have no fear whatsoever. They look forward to coming to the dentist. It's something to be excited about.
What exactly do you do to make the trip to the dentist less fearful?
Yeah, well, many years ago, we just started designing a special process for nervous patients to give them the time that they need to identify the specific things that they're nervous about. It varies from person to person, so we have a consultation process where we don't start on the dental chair with their mouth open. We start in a special consultation space, which is very relaxed, having a coffee and just going through gently with them exactly what it is that they find difficult, and then making some suggestions about how we might design the process for each patient.
So how high is the success rate then?
Well, I think it's very individual. Each patient judges it on their own terms. We've got a big group of patients who remain nervous, but they bring their anxiety to a level where it's under control, and they have a trusting relationship with the dentist so that they can work away at getting their dentistry done and achieve, you know, a healthy, confident smile, which is usually their goal. And then there's another group of patients which is a little bit smaller, and they have a breakthrough, and the phobia actually lifts completely and goes away, and they just go on with their lives and get everything done super quickly.
In the case of Lisa now and Katie and Holly, Lisa was very nervous about passing on her phobia to her children.
Yeah, and a great many parents express this concern, and perhaps a lot of people don't fully realise the phobia that their parents might have because it's hidden from them, because parents are expert at that. So we've got a lot of phobic patients whose kids have flawless teeth and no fillings, so a good thing has come out of a bad thing. And then we do have some patients where nothing bad has happened to them. Maybe they've overheard something in the house and they've become a little bit conditioned, and there is a way to help those people as well, just to get them normalised and accustomed to feeling safe when they're in the chair.
Now, obviously, this is a private practice, but would you say, on the whole, now in Northern Ireland, NHS dentists as well would be very aware of treating perhaps children or patients with a bit more respect when it comes to their fear?
Oh yes, there's been a real step change in the profession in the UK over a quite long period, and there's a lot of practices that will have a special process for nervous patients, and the main thing is just to ask for that when you phone up and make some inquiries and see how you feel on the phone with the practice and how well you click. But there's loads of practices with staff who are really, really gifted in this area and very good at helping people stay relaxed and feel at home.
And it's nothing to be ashamed of?
It is the most normal thing in the world. I mean, dentistry is all about trust, and you have to have a good relationship. If something does happen to get in the way of that, then the right thing to do is just to start talking about it and get it out on the table. And often when you've done that, that's the biggest step, and things do flow really well from there.
Lisa is a real success story.
Lisa's been fantastic, and I'm so impressed with what she's done, and she was very, very clear at the beginning about what her goals were, and that made it easier for us to respond to that and just take her through a process where she felt her anxiety coming under control gradually. And the girls are a fantastic testament to that. I mean, they've no sign of it whatsoever, and it's just real fun coming to the dentist. So I mean, everybody's just so delighted about that.